Well, while everyone's joining, we'll kick things off. Really nice to see you all. I'm sure there'll be more people jumping on the call in the next few minutes. Good evening and welcome. It's great to see everyone. This is our final environment session of the year. It's been a big year. We've had a lot of fantastic speakers on a really broad range of topics, um, both climate and biodiversity. Um, we certainly hope you all feel like you've learnt a lot through the year, and with that knowledge that you've been able to influence others in your community for positive action. And I certainly feel like I have learned a lot again, um, very much. I'd like to acknowledge we're on Gadigal land, and I'd like to acknowledge the traditional owners of country across Australia from wherever you're based, and recognise their ongoing connections to lands, waters, and culture, and also to pay our respects to elders past and present, and also to extend that respect to any First Nations people on the call tonight. So we're delighted to have tonight the topic joining the dots between health and climate. We're going to hear from Michelle Isles, who's the CEO of the Climate and Health Alliance, and we'll have a Q&A after that. And then we're going to hear from Helen McGowan and Phil Haynes, who are from Regional Voices. They're going to talk about the upcoming federal election and the regional seats they're targeting with independent candidates. And then finally, to round things out, we're going to share some results of a member survey that we did a couple of months ago, and a shout out to Steve Lewis, who's done a lot of the work, most of the work for that. So the topic tonight, climate and health. This is something that I've wanted to cover for a long time. I think I'm even going to say a couple of years. Many of you will know that I originally trained as an OT, but I've had most of my career in marketing. And a lot of that has been in health and health promotion. So my OT foundations haven't left me. I go to the Australian Public Health Association conference every year, and that's where I met Michelle this year, which was fantastic. She kindly agreed to come on. But back in 2018, the conference was in Cairns, and a lot of the focus was on climate and health. I've always believed in climate change, but actually seeing the science was quite shocking at that conference, and it's really stayed with me. And a lot of what people talked about has eventuated in the last 5 to 6 years. So I don't want to steal any of Michelle's thunder, but I'm really, really pleased that you could join us tonight, and thank you. Michelle's the CEO at the Climate and Health Alliance. It is Australia's peak body on climate and health, with a mission to build a powerful health sector movement for climate action and sustainable healthcare. CAHA represents over 100 health and medical groups, academic and research institutions, healthcare service providers and unions. And Michelle joined CAHA as CEO in March this year. Prior to that, she was Senior Advisor, First Peoples at City Power and Powercor, as well as at United Energy. And she's also had previous roles as Head of Sustainability Integration at the City of Melbourne. We are very lucky to have you tonight, and welcome, Michelle, and over to you.
Thank you so much, Carolyn. It's a real delight to be with you. Thank you for inviting me and to join all of you tonight. I was really excited to learn about this network. I know you all bring a lot of wisdom and expertise. So while I'll be sharing what some of the things that I've learned and know and a bit about CAHA, I'd love to involve you in some of our yarns and discussion and action. So I'll share a presentation, but please stop me throughout. Like I said, share your wisdom, ask questions. I'd love it to be informal. So I'll just get this shared. Okay. So thank you again, Carolyn, for the introduction. I should say I have some expertise in public health, but I've been working on climate change for 23 years or so, and I'm trained in environmental law. So I've worked at the nexus of law and climate and health for many years, and from every different sector, actually. So it's great to have landed in CAHA, yes, in late March this year. So I'd like to acknowledge, and on behalf of Kaha, the knowledge and wisdom of First Peoples, whom we work with both in Australia and in New Zealand and the Pacific Islands, which is our remit. We recognise, in particular in the Australian context, the sovereignty of First Peoples, and that was never ceded. And as Kaha has worked over the years, we've been around 14 years. We've really had justice and equity at the heart of the work that we do. Health is an equity issue, and we recognise the strength of First Peoples in caring for country and also for health and well-being. And one of my many roles over the last 23 years was as a general manager of a hospital during COVID, I say just for fun. And one of those opportunities in health, I think it's fair to say in any organisation I've been in, I've looked at governance and First Peoples governance in particular, because I think it's important, it's powerful, and that was certainly the case when working in Gippsland in this particular role. And I've got here some really important and special individuals that I've got to know and become a big part of my life. And these are people that represent Bunurong and Bunurong and Gunai Kurnai, peoples here in Gippsland that came to the table to help shape the governance of a health system that wasn't being accessed by Aboriginal and Torres Strait Islander peoples. Community were travelling an hour and a half to get health services, and that's because historically this hospital and health service had not been a safe place to access. But by centering First Peoples governance in this health service, it actually transformed the way staff and community began to think about health. We tend to talk about person-centred health, and there may be some health experts in this virtual room here today from an Aboriginal and Torres Strait Islander lens, which I bring through this learning and also personal experience and family. It's absolutely about the people, family, community and environment. And so we tend to think about the whole system of health from a physical, mental, spiritual and cultural perspective. And when you get centre First Peoples in governance, you also start to mobilise and connect community. And this was really critical when I was running this hospital. So this is, if you know Victoria, this is the bridge to Malau, which is known as Phillip Island. And there's thousands of children and community members gathered together. During COVID, we also had the shocks and stresses of climate change. And given our late transition power outages, part of that. So some of our community members were out of power for a week, 2 weeks, and we had phone lines down. We actually did not have ways to connect our community and understand the health and well-being of everyone in our community, except when we connected with community leaders. So, we had communities knocking on doors to community leaders to then reach out and connect and mobilise. And the First Peoples, Aboriginal and Torres Strait Islander community were a big part of this and were one of the first responders to the COVID challenge. So I just wanted to start with that as a really fundamental part of the way we think at Kaha, but also my experience. So Kaha is an alliance. Carolyn mentioned we're around 100 or more members. We were founded 14 years ago when a major climate event occurred and there was recognition globally of the health challenge. We started with 4 members and have grown over time. Some of those members have become really proficient and expert at responding to and leading on climate change. They represent over 70 health professions. We have more and more Indigenous organisations joining and also private sector. Private health coming to the table. So that list doesn't include Bupa have just joined, and many of our private health organisations that want to lead on and collaborate on solutions. Our mission and vision were mentioned, mobilising, connecting, drawing on the shared resources and knowledge of those members is really critical to create impact. And we look at it through this framework of leadership, of recognizing and helping community to recognize the impacts of climate change and the solutions by having influence, and also then building resilience in our health systems, because our health workers are on the front line of climate change response, and I'll get into that. So climate change is a health problem, and in fact, this was sort of the catalyst journal article and then conversation that started happening globally that was a reason for CAHA to be formed. So the Lancet Medical Journal is the renowned journal that publishes health evidence globally, and we now have a local version of that. So vulnerability occurs across many different factors, from demographic to geographic, biological. So we consider all of these things when we're talking about health and health vulnerability. And there are many different exposure pathways, many of which you will be familiar with, both through your professional spheres and now also personal experience. We know inherently that air quality is bad for us. The evidence is quite extraordinary, showing the health conditions that it actually leads to and exacerbates, including and especially in children. I've just been working on with colleagues a campaign around idling off, the impact of vehicle emissions on children's lungs. The way in which they absorb pollution creates more impact. And there's other issues, of course, you'll be familiar with. And I mentioned health system capacity and resilience. And so I was just at a conference with international colleagues in Vietnam, where typhoons are constantly hitting both the Philippines and Vietnam more often. And we talked about our physical infrastructure breaking. It is going to break. And I'll talk a bit later around how we build resilience, not only in physical infrastructure, but most importantly, social infrastructure, and through the way in which we deliver services. And there's many climate sensitive health risks from heat-related illness. And, hopefully you're starting to see, again, in your spheres of influence, that evidence coming out in the media. You're seeing the unfortunate impacts and risks, including the relationship. Today I was in a Victorian it's a health and wellbeing strategy and framework for the state. And we were talking about lots of siloed issues, gender-based violence and, diabetes. And yet climate change is a threat multiplier, as you may know. So it exacerbates all of those conditions, makes them worse, and has the potential to undermine all that good work in preventative health. So this is why it's important. I should say, having worked on climate change for 20 years, focusing more on health in recent years, there's a lot of heavy evidence and data, but we'll get through it. And it's about understanding those and joining the dots to then know what some of the solutions are. And so this is just another take on that, looking at how climate change impacts human health. And this is a really interesting model, and there is a live model via the link that shows over half of known human pathogenic diseases can be aggravated by climate change. And the thickness of the lines determine the severity. And so, if you look at the flood events that were recorded, linked to waterborne diseases and bacteria. So it's a really interesting and deep evidence base that we're growing both globally and in the Australian context to understand these connections. Thankfully, there is recognition that also tackling climate change, I should say, is a health opportunity. And we had commitment from the Minister for Health, Mark Butler, to a national strategy on climate and health that CAHA had advocated for many, many years, with this clear message that good climate policy is good public health policy. And we work at that intersect to get health in all policies, but also to get climate change thinking in health. There are many costs to climate change. Sorry, as a result of climate change, I can't see the top of my screen. Climate change increases health costs is the message. This is not modelled as we would like. So it's not, when we look at national emissions modelling, we're not considering these health costs and impacts in decision making. So we might think of the social impacts of recession if we don't move quick enough, but we're not considering the health impacts that are happening already as a result of the way in which we generate energy, and also then the leading to climate change, those health impacts that are incurred. And so that economic burden of disease, looking at direct and indirect costs, is really critical. And this is something where we are gathering evidence. We work with our research partners to translate some of that research into policy understanding, but we feel there's further work to be done to really get the traction we need in terms of getting the decision making reflecting health in all policies. And of course, there are populations that are at greater risk. I mentioned we work with and in the Pacific Islands, but also in subsections within our communities here in Australia. Of course, there is disadvantage. There's already health inequity. And so climate change, again, exacerbates those inequities. And there's some examples here, thinking about, again, the pressures on people, the nature of work, the way in which people participate and what they have access to. So there is a raft of evidence now around joining the dots between climate and health. And I mentioned that, we now publish our own Australian Lancet countdown, which tracks on an annual basis the links between climate and health and the progress we are making, or lack thereof, on policies. And so these are some of the key findings of the report that was released early this year, and we provided a guide so we could brief our health professionals on that, and on those on some of those solutions and recommendations. There's a lot of research now looking at extreme heat. We've got dedicated centres. So, for example, in Sydney, we have a dedicated heat testing centres where people are monitoring the impacts of extreme heat, so they can actually model that. Thinking about heat in sport, heat in workplaces and in different conditions. There are members that are focused on mental health, that are looking at mental health strains, and something that, there was a study released, really awful, around suicide risks exacerbated by climate, health and heat. There's also increasing studies around the impact of the way in which we deliver care. And this is really interesting work that's been done by Asthma Australia and Deakin University that involved hundreds of experts coming together to understand how we can look at the challenge of asthma, which is caused by a lot of the ways in which we live through urban planning, thinking about the impacts of transport, of gas in our homes, but also the way in which we currently treat asthma, through the dispensers, has a huge carbon footprint and impact. So this looks at the impacts from many different perspectives and brings together some solutions around the way that we can change the footprint of the way we care for people suffering from asthma, to then stop the factors down the line that will further impact asthma, thunderstorm events, etc. This study I just wanted to point out to you. This is obviously me at one of the many Senate inquiries I've now been to. And this was really shocking, actually, to get across this report. This was at the Middle Arm Senate inquiry, so where there is a sustainable development hub, which is mostly petrochemical and looking at gas production. This study put together by one of our members, Professor Melissa Haswell, with other experts, Jacob Hegedus and Professor David Shearman, looks mostly at studies that are in the US and Canada, because they have unfortunately had a longer period of time in which to gather evidence and see the change in health conditions due to fracking and gas. And so it's actually a really easy to read study, but brings together hundreds of pieces of evidence to inform an Australian policy base, and actually to say, look, we've seen what can happen. Let's actually heed some of this advice. And so, for example, this end inquiry is looking at the expansion of a facility which is within 5 kilometres of where people live, and there's some very worrying concerns, let alone the climate impacts that will be caused. We've done a lot of work in the transport space, getting together experts from across sectors, bringing health evidence to the table. One of my first jobs was actually in Kathmandu, measuring air quality in the Kathmandu Valley, which you can imagine, the pollution's trapped. And so it was looking at what role were vehicles playing in creating pollution. There are high instances of asthma and respiratory disease, as there is here in Gippsland due to coal production and coal-fired power. So we looked at then what are some of the policy avenues, and Nepal ended up introducing a vehicle emission standard. Still a huge challenge. Australia introduced one for the first time this year. That was 20 years ago, I should say. So we're a little bit behind the 8 ball on that. But this work, as well as many other NGOs and experts, bringing that health evidence to the table, helped to get that complex policy agenda over the line. Plastics, I know there's a lot in this. Plastics is a climate change issue. We often think about the water bottles bobbing in the ocean, but this is actually about the inputs to create plastics that harm human health. And so we have been advocating at a national level, and we help to get plastics in hospitals on the National Stewardship list that the Environment Minister, Tanya Plibersek, looks after. And we were part of a delegation. We didn't travel to Korea, but our colleagues were there in force just this month. Unfortunately, the International Plastics Pollutions Treaty failed due to some nation states that, without surprise, are involved in oil production. But Australia is committed to this, and there is growing evidence around the impact of of plastics on human health. I think this diagram shows some of those high-level impacts, and that's why it's a centred in our policy and also the work of our international colleagues. I should say that KAHA helped set up the Global Climate and Health Alliance, which now has hundreds of members, and we're also a strategic partner with Healthcare Without Harm that was started to remove mercury from treatment from hospitals. So looking at those chemicals and substances that caused harm that are actually being involved in treatment. So we work very closely with them, and plastics is a key focus area. We are all now aware of some of the climate impacts that are happening in Australia. We track those along with our partners. Just this summer, these are some of the impacts that we captured, including in New South Wales, the temperature challenges and coastal cyclones. In Perth, we had 9 days over 40 degrees. And so what we did is we spoke to the health leaders in our networks and got them to talk about that connection in the media and in our communities. It's part of our model of change and theory of change, is that if we get trusted voices, health is in the top 4 of trusted voices in Australia. If we get those leaders to join the dots for our community, then we're more likely to get action on some of these that will prevent some of these severe impacts. There's some great research out there, but there's more to be done. And so there's, some of our members and colleagues are looking at this, where there are currently studies and where there are opportunities to focus on climate and health in Australia in particular. So we worked for many years to articulate a framework and strategy. During COVID, we got 500 health workers together to look at what the future could be and then backcast so that we could work on scenarios. And we came up with this healthy, regenerative and just strategy, which sort of set again the frameworks and principles through which we could in Australia respond to the climate and health challenge. And that then set the foundations for a national health and climate strategy, which we were delighted was launched in December this year. And the national unit has built quickly. There's been about 15 staff working in the Australian government, sitting in the Centre for Disease Control, which was interim until about a month ago. And CAHA was proud to advocate for that CDC to be achieved on a long-term basis, also because it would then unlock some of the barriers to funding this national health and climate strategy. So we were proud to be part of this, as were many of our members, and I now sit on a national ministerial advisory committee guiding its implementation. And we are committed to tracking progress. We didn't get any budget or resourcing for this strategy because of some of the aforementioned issues, but it's about that transparency. We work in partnership with government, but also as an NGO, work to ensure that we're responding in a way that reflects the crisis we're dealing with. And so health and climate impact assessments is something that we are advocating for strongly because of some of those challenges I mentioned, like with the Senate inquiry. We've got a huge health evidence base that we can look at, albeit from different jurisdictions, but there are many similarities to be drawn, and we can see the risks, but we don't have a mechanism to actually create a hurdle in decision making. There are many co-benefits to health and climate action, and this is a terrific diagram that's put together by many learned people, including Nick Watts, whom I work closely with. He helped set up the national, the NHS, which is the British Climate and Health Unit, has really been, a leader internationally. So you'll see things like reducing meat consumption is better for health, so less cardiovascular disease. But then, of course, if we're reducing the footprints of cattle on our land, and that's a controversial argument here in Gippsland. But there's a win-win there to be made. And then we've done and provided lots of guidance in our community, and want to get that out further, that climate action is good for health. So we do lots of advocacy. We train up our healthcare workers, and we've looked at, public health campaigns in the past. Like, we've actually been able to, reflect often with colleagues. And if you're about my age or older, we all know how embedded cigarette smoking is. My mother trained as a health professional in medicine, and on the ward, there was a cigarette machine when she was training in the early 80s. It was so embedded in everything that we do. And so, we have had big wins in public health. Climate change is one of our biggest challenges. So applying a health lens, we think, can move the dial and be something that connects all of us. So we surveyed health professionals, and they unsurprisingly told us that they already saw health is happening. 1 in 7 Australians are health professionals, by the way. And so when we see arguments around transition of of workforces, I'm so focused on health, it's in everything I say, on workforces. So, for example, in Gippsland, there's been a huge transition in thinking about coal workers and in forestry and the like, but most people employed where I live work in health. And those health workers were already seeing the impacts of climate change in really specific ways. So staff being absent from work, transport affected, health affected, power failures, etc. And so we train our health workers with really simple messages. So you don't need to know everything about climate change or everything about health, but there are connections. We know there's enough evidence to make those messages clear. And here's some examples of some of our trainees and health leaders. So we, looking at those pillars, we look at leadership and influence. And these are some of the ways in which we have supported and trained our and worked with our international colleagues on advocacy. go through a bit of the slideshow, we wrote a guide with the WHO on communicating climate and health. So it's a toolkit for health professionals worldwide. And then we tailor that to specific audiences. I mentioned that health has an impact. It's about 7% of emissions, of Australia's emissions. And so there's an opportunity for us to achieve outcomes through actually making healthcare more sustainable. And so one of the ways we do that is delivering this international global green and healthy hospitals program. So it's delivered, 68,000 hospitals and health centres across the world working together on impact. And there's about 4,000. I think it's closer to 5,000 now, actually, across our region, Australia and New Zealand. And we also work with state and territory governments on leading policies around health and climate. So, I mentioned that, there's about 1 million healthcare workers in Australia, and they can make a difference. So thinking about that health lens in policy making, in action, is really important. And thinking about the role that health leaders can play in community as trusted voices is important too. We have had public health wins. Prevention is better than the cure. And so, we would love to partner with you in any way possible, or, keep in touch around our work, because we see that intersect. To get health in all policies, we actually have to work with all sectors, and to look at climate in health, we need greater visibility of the challenges and complexity of health, something that affects all of us. So we are a non-for-profit. We're a small but mighty team that has a pretty big remit. So you can get involved by supporting us, and get in touch anytime. Thank you.
Thank you so much, Michelle. I can't believe how much you covered in a short space of time.
Sorry, there's a lot of slides.
No, it's amazing. Thank you. I love all that you're doing. I'm sure others on the call do as well. I just saw that Tim added a note to the chat about podcast recommendation around electrifying all our public hospitals. So that's a great
Great. Yes,
tip.
our Healthy Futures member is advocating for that actually at the moment.
And Shannon, I can see your comment too about we've got another go at the plastics treaty, so that's good to know.
Great.
I've actually got so if anybody has any questions for Michelle, please pop them in the chat and we can cover them. But to kick us off, I was going to ask you, at the risk of becoming political straight away, does it make a difference who's in power, or do you feel like there's enough sort of common ground around the impacts that you can find areas to work effectively to improve outcomes, health and climate outcomes?
Yeah, look, we're obviously a non-partisan organisation, and I think having worked at climate change and energy from many different angles, I've seen the polarisation of issues as we all have, but I really think that health brings common value and commitment. So I do think we can work with anyone. I should say though that we had developed these quite sophisticated frameworks and thinking over many years, and it took a long time, about 10 years, and that's a familiar time frame that most people talk about in Australia, where there wasn't as much action and traction. So that's something to reflect on, but we're here right now, and I certainly, in my role in the last 8 months, have spoken to politicians of every colour and shade, and it's been really interesting, I spoke with Senator Jackie Lambie, who's head of this sort of resilience committee, knowing that I would find connection there and build connection there. I've been I think, having been in a leadership role in a hospital and health service in an area where you'd say there's definitely been conservative politics over many years, the connection with health is, again, widespread, and so in that role I was navigating and working with such a diversity of leaders who had common concerns and values, and I think that was really great training coming into this role, thinking about how we navigate and and get that traction we need. I've also reflected on the, our name, the Climate and Health Alliance, and how much we talk about climate change. But I think in our training, we really, keep it simple. In terms of, this is happening, it's bad, we've got a role to play, we can do it. These are the pathways.
Yeah, that's fantastic, Michelle, and really, really great. I mean, that message comes across really clearly, which is great. Do you think, in terms of the general public, are they making that link between climate change and health? Do you think generally, because it's such a powerful message, is that resonating? Do you think?
Yeah, I think it is, although we can do more. Again, and even in this role, my first role was as a journalist, and so it's been interesting speaking with journalists and other conduits of public communications, gauging what they understand, even around air pollution and that impact. So I think, again, we inherently feel it's bad for us, or we experience it. I've got a 5 and 9-year-old, and they talk about the pollution impacting them. But I think there is still more to do to make that connection known. And I think that's why, everyone knows a nurse. I think we need to keep expanding our work to get to people that are in communities, that are trusted in communities, to have those conversations, to have those yarns that are not necessarily formal, but are joining the dots. People are definitely, the evidence showing, are experiencing climate change. They're knowing and seeing that there are now stark differences in extreme events. It's then joining the impact, the health impact, and the action. And that's the challenge that we face.
Yeah, definitely. And then Roynton and Brendan have asked one here. So they're interested in the problem of waste in delivering health services. So plastic packaging, one-use disposable items, that sort of thing. Any insight on how this might be being tackled within the health sector?
Yes, thank you. I didn't touch on waste, and other than plastic, and waste is a huge issue. So we're looking at it from different levels. So we work with, these almost 5,000 health services. We also work on advocating for product stewardship and with supply chains. So through some of my international work, I've been linking with private sector supply chain networks to drive impact. And then looking at state-based, so there's a network of state-based procurement leaders, so looking at what role procurement can play. But with the national stewardship work, we really want to see some accountability and, frankly, not just incentives. And we need some sticks. We actually need to say we need to get plastic out of healthcare. We've got really innovative solutions happening at the healthcare service level. So, there's a program called Gloves Off, for example, where clinicians are leading with campaigns saying we don't need to use gloves in all circumstances. What is it that we can actually remove from our practice? But the suppliers also have a big role, because, when you have looking at cesareans or any kind of surgery, these big kits come now and everything is packaged, and you open it up and it can't be used again. It's awful, but it's also something that really motivates our healthcare workers, because they see that waste and they want to do something about it. It's right in front of you. Some of the other issues, the burden of disease, yes, they see that, but it's something that they feel they can do. So we have a waste community of practice, and we've got about 150 health leaders in that. We gather case studies, and then we use those case studies to help advocate and leverage for change, for policy change and procurement change at different levels.
I'm amazed by how much you managed to do with a small team. It's really, really impressive. There's a few more
questions. I think we've got 100 members, so I think we draw on those experts as well. Yeah, but we could always have a bigger team, let me tell you.
There's a couple of questions in the chat that we'll try to come back to at the end if we have time, because they're really interesting questions, but I'm going to hand over now to Stephen.
Yeah, thanks, Michelle. That was fantastic. So now I'm going to bring into the conversation Helen McGowan and Phil Haynes. They're both from Regional Voices. So welcome to both of you. Thanks for joining us. And they're going to speak a little bit about the upcoming federal election and the regional seats that they're targeting around Australia. So Welcome, Helen, and welcome, Phil.
Thank you, Stephen. Thank you, Carolyn. So look, I might just kick off quickly, introduce myself, then hand to Helen to introduce herself. And then we've got about half a dozen slides to go through reasonably quickly, and then we can take any questions. So I'm Phil Haynes. I live in Northeast Victoria in the electorate of Indi. So in 2013, we bucked a trend nationally and was the only seat in the country which the LNP lost in that massive swing to the Liberal Party under Tony Abbott. So our sitting member was defeated, and Cathy McGowan was elected as the first independent member for Indi. And since then, she had 2 terms, and then Helen Haynes, my wife, was then elected in 2019, and we elected in 2022. So we started a group called Voices for Indi back in 2013, which created this shift to independence. And it's now become a movement across the whole country. So we'll talk a bit tonight about the impact of that in regional areas of Australia. But I might just hand to Helen first just to introduce herself before we do some slides.
Yeah, thanks. And thanks, Stephen and Carolyn. Fantastic to be here. There's a direct link between Michelle's presentation and what we're inviting listeners to do, which is to take action. And it's so comforting to see the nation and the health bodies signing on to those strategic plans. So as Phil said, the movement that we're focused on is community independence. Our particular focus is in the bush, regional, rural, remote communities. And the Regional Voices Fund is about raising funds from donors to support those candidates. So I've been involved in Indi as well, in Northeast Victoria, and I'm also a director of the Regional Voices Fund. So we're just here tonight for 2 reasons. 1, to inform you about the fund and invite you to spread the word, and 2, to encourage you to get involved in your own local communities to take action, to give voice to your community. And it's a really clear call to action for those who care to get involved and to use the democratic tools available to us to support the nation. So we've got a little bit of a slide that we'll just quickly run through.
Just while Helen's doing that, I think Michelle mentioned before about not getting too political. Well, Helen and I are about to get quite political. You might recall many years ago, Paul Keating, when he was then Prime Minister, said, if you change the government, you change the country. And I think that is a very true statement. And I think if you can increase the crossbench, there's more chance that whichever party gets government can actually develop policies which are more appropriate to what we want to try and achieve. So if we just go back one, Helen, yeah.
Yeah.
Yeah, thanks for that. So Seeds for Change, we are looking to try and create change across regional Australia. For those who are pretty much engaged in the political process in 2022, you will know that there was a massive shift to independent candidates becoming MPs in Sydney and in Melbourne and in Perth with Kate Chaney, but not so much outside the major cities. And if we think about climate change, as Michelle has encouraged us to do tonight, many of the biggest impacts in climate change will happen in regional Australia, and also many of the opportunities in terms of shifting to renewable energy will also take place outside the major cities. So we're keen to support candidates across regional Australia to develop good campaigns and to give people a choice at the ballot box, which is due to happen before May next year. And we are setting up this fund, have set up this fund to try and help those candidates. So the aim, our very ambitious aim, is to raise $2 million by the next election, which I said is due before late May. And there's been various speculation about when. Some people think maybe March. April is firming up as a date before Easter, but certainly the next 3 to 5 months. So we aim to raise $2 million by the next election, and we are trying to fund out or disperse our first 500,000 by the end of this year. And as we speak, we're going through the first funding round, and we hope to be supporting up to 9 candidates across regional Australia, which we'll spend a bit more time going through those now. So here's a map of the country. The first batch of seats on the left-hand side, I'll just go through these reasonably slowly. So Indi is where Helen and I come from. So Northeast Victoria, as I said, Cathy McGowan elected in 2019. 2013, and then Helen Haynes elected to replace her when Kathy retired, becoming the first ever independent to follow an independent in the House of Representatives. So that figure afterwards, plus 8.9%, is Helen's current margin in Indi. The next batch of electorates showing Taupo is Mid-North Coast, and a woman called Kaz Heiss, who, Michelle, as you would know, is a nurse, is a recently resigned executive director from the Regional Health Service. So she ran last time, and she came very close to winning that seat from the National Party with a margin of 2.3% down. Wannon in Western Victoria, Alex Dyson, this will be his third campaign actually. He ran as a newbie in 2019. Last time he got 20-odd% of the vote and lost the electorate, lost the seat on a two-candidate preferred basis by 3.9% to Dan Tehan. He's been there as a Liberal MP for 14 years. Casey, on the outskirts of Melbourne, picks up the Yarra Valley. The woman who's running there also ran last time, and this was also very, very close. 1.5% was the margin she lost by. Monash, also in Eastern Victoria, picks at some of the dairy country. Deb Leonard ran last time, got very close, and this time she's running again. 2.3% was the margin last time. And Groom, situated around Toowoomba, just outside Brisbane. Susie Holt ran in 2022, and even though she got a reasonably low primary vote, by a quirk of all the preference flows, she became the second candidate, so two-candidate preferred vote, and she lost by 6.9%. And the last one in that batch, Calare, which picks up towns like Orange, Bathurst, Lithgow in New South Wales. Kate Hook ran in 2022, did a pretty good job against the sitting member Andrew Gee, who has since resigned from the National Party, and he will recontest as an independent, and Kate is running again. So those 7 seats with Helen Haynes as the sitting member, the rest as candidates, all ran in 2022, and they've all commenced their campaigns. They've been chosen again by their local communities. And in the case of most of those people, they've resigned their jobs and they're working full-time on the campaigns with a much more substantial campaign team. And they hope to get more resources to help them build the best possible campaign and really run great campaigns against the sitting members. The next couple, Forrest and Farrer. Forrest recently announced their candidates. So that's over in WA. And the sitting member there from the LNP is retiring. And she only won the last election by 4.3%. So again, that's a pretty tight contest. And another person from the health sector, Michelle, a local surgeon, is running as the independent candidate, the community independent candidate in Forrest in WA. And the last one in that batch is Farrer, Southern New South Wales. Susan Lee's seat, she's been a sitting MP there for 24 years, deputy leader of the opposition, Liberal Party. That's a pretty big margin she's currently got. Michelle Milthorpe was selected by the Voices for Farrer group about 2 months ago. She's also resigned her job and is campaigning full-time in that electorate. So just to summarise those, they're the seats where there's either a sitting member, in the case of Helen Haynes and Indi, or the rest of them candidates have been chosen, most of which who ran last time. And the margins, by and large, are pretty close. And what is different this time is each of those candidates has started their campaigns much earlier. They've got bigger campaign teams backing them, but they need resources to run the best possible campaign to have a chance to defeat the sitting LNP member in those particular seats. And the next 4 listed there, Nichols, Lyne, Grey and Riverina. So Nichols in Northern Victoria, Lyne in New South Wales, which for those with a long memory recall that was Rob Oakeshot's seat for a term. Grey in South Australia, which is the 3rd biggest electorate in the country, 900,000 square kilometres. And Riverina in Southern New South Wales, Michael McCormack is the sitting member. And on Wednesday, they are running their Meet the Candidates Forum, which they've asked me to host, and they will select their candidate from that meeting on Wednesday night. So let me just draw a breath there for a second. That's a lot of information. The summary is, though, that there's a lot of fantastic candidates running, most of whom have got very strong credentials around climate. They want to see active climate change taking place or climate action taking place. And most of them have very strong campaigns around renewable energy across their particular electorates. This slide here, I think, for those who follow the polling, there's been 3 polls in the last 24 hours. Will know that it's not just a hung parliament being the most likely outcome. There's as much chance now that the Dutton-led Liberal National Party coalition could have as many seats, if not more, than Labor. So the recent polling the last 2 days has either 50-50 Liberal Labor, 2-party preferred, or in the case of a poll today by Morgan and one yesterday by Resolve, it has the Liberal National Party in front, 51-49. So the reality is, let me tell you that there's a fair chance the Liberal Party will pick up quite a few seats from Labor in the outer urban areas of Melbourne, Sydney, Perth and Brisbane. The best chance to stave off a LNP government next election is for a number of these regional independent, community independent candidates to run the best possible campaigns and to unseat the sitting members. And that is a good thing, I reckon, because if we have 2 or 3 more independents from the regions in Canberra next year, I reckon there'll be a lot better policy on the crossbench, and it doesn't matter which government is in minority governments, Labor or the Liberal National Party. I think there's more chance that evidence-based policies can come to the fore. And just that last slide, maybe, Helen, if you can go back to that one, last couple.
Yeah.
If you can find those, please.
So Phil, you want to see the one with the balance of power?
No, just the one with the who's on the on our advisory committee.
Oh, yeah,
just to
there
give a
it
bit of a
is. Yep.
sense. Yep,
Yep.
please. And the last one's the contact details.
Yeah. Good. And I can pop in the chat how to talk with us.
Yeah, great. So Helen's just going to show some of the people, apart from Helen and myself, have been involved in setting up the Regional Voices Fund. It was launched about 2 months ago. You might have seen news items in the Sydney Morning Herald and The Age, and also it was part of a major piece written by Brooke Turner in The Good Weekend, that particular weekend. So we are very hopeful. It was fantastic last election to see all the women elected in Melbourne, Sydney and Perth around a strong basis of climate action, integrity and women in politics. We hope they are all re-elected with some more, but we also need more people coming from the regions to give effective voice to what we think we need across regional Australia. So if we can't find the slide, the other key people there, Alana Johnson, who you may know of, Andrew Baum, and Lorraine Gordon, who comes from the mid-north coast of New South Wales. And she's a farmer, very strong in climate action, and she trades carbon as well. And our contact details, here is our website. We would really welcome any support that either you folks are prepared to contribute, or if you can put us in touch with others who might have an interest in supporting the fund. We'd be very keen to talk to them about what we're trying to achieve. Helen and myself and the other board director are all volunteers at the moment. So we're trying to do our best to move away from perhaps what's been traditional representation from the regions, National Party and Liberal Party and sometimes Labor, to a more community-based, community-focused local member of parliament. So I might leave it there, Stephen and Carolyn, and happy to answer any questions from you guys or anybody else about what.
Yeah, fantastic, Phil. Thank you. And we'll circulate all those details in the notes and stuff. So thanks for sharing all that. It's really interesting. And I mean, in terms of just the momentum and how it's going, and Helen, I might bring you in here. Do you want to just chat a bit to that?
It's excellent. We actually have had 19 donors. Some have been as small as $20 and others have been significant, like three figures. Our aim was to get 500K by the end of the year. We're actually sitting at half that. However, we're running at our first distribution is going to happen in the next week. So we've invited all the regional rural remote campaigns to apply. We're now going to put it before our advisory committee, and we've got some measures to actually see whether they are community informed, whether they've got the capacity to raise their own funds and volunteers, and the compact with the community. So it just comes back again to encouraging democratic action at the grassroots. We want to see that happen. We want to see them listening. We want to see them advocating for their community. So we're really chuffed that the first lot of money is going out the door next week.
Oh, that's fantastic.
Yeah, so the invitation is just please spread the word, let people know, contact us. Phil and I and Lorraine can talk directly to anyone who's interested in being a donor and just give more detail. We've got frequently asked questions, a little bit more detail available as well. But thank you for the opportunity tonight.
That's interesting.
And
And
we're very happy if you share our phone numbers and email addresses, Stephen and Carolyn. Anybody who's got an interest who comes back to you, happy to share those.
don't you worry, Phil, we'll
contacts.
share a lot.
Okay.
Interestingly, Karen and I went to a function put on by the Climate Council during the week, and they were talking about the regions quite a bit, actually, in terms of where they're targeting. And in particular, I don't know if you want to comment to this, about how much climate is resonating with women in the regions. They were particularly focusing on that, on women in particular.
Maybe it's one for you, Helen, if you want to answer that one.
Yeah, I think definitely. Like it comes down to the caring and connection to family and relationships like we see it. And as Michelle's presentation so brilliantly captured, and for me, that link between the lived experience and the importance of policy, evidence-based, but also keeping a finger on the pulse. So I think women as carers, and I can just speak for myself, as living in a rural area that's been subject to fires probably most summer, and who knows what's going to happen again. It lives in your body, the trauma and the fear of the future, and people are highly motivated not to continue to put up with the a lack of action. And even though we've got this federal government that was elected on a mandate to do better, there has been some disappointment that it hasn't been as centred as we would like it to be. So yeah, that resonates strongly, the Climate Council observation that women want to fix it. And I'm going to say in the community movement, community independence movement, a lot of the volunteers and all of the candidates are women, particularly those with a bit of lived experience.
Yeah, fantastic. Thanks, Helen. And thank you both very much, and good luck. It's
Yeah,
fantastic.
wish
Thank you.
you
Yeah.
the very best.
Thank you.
It's exciting to see this initiative.
Yeah.
And some of those seats I know are getting a little bit of steam, and yeah, I mean, it's great that regional people feel in some areas that they might have someone who really represents them. It's really exciting. Lai Heng, you've got your hand up.
Yes, I have a question
Yeah.
for Phil and Helen. So I'm a political novice, but I'm just really committed to change the course of politics, to ensuring our sustainable future. So the Greens have kind of been demonized by the two major parties, and not really kind of joining hands with the independents. What do you think the strategy should be, and how do we increase the power of the crossbench to make sensible policies, as you say?
Let me have first crack at that. So I think the Greens have certainly taken a different approach this Parliament. They've been much more oppositional, especially on housing. You might have noticed in the last week of Parliament, the Greens actually backed many of the government's legislation and helped pass it through the Senate. On the last sitting day, they passed 32 pieces of legislation. I think they're going to change tack. I think they now realise that if they keep opposing all the time, there's more chance that there could be a Liberal National Party government after the next election. That's the first thing. I think if you follow politics a little bit, you'll see that it's the crossbench who are actually doing a lot of the hard lifting and work on bringing forward good policy around climate in particular. Zali Steggall has led that in this particular Parliament. Others have also been working very closely with her. In the last Parliament, it was Helen Haines who did all the work around integrity. She's the one who brought forward legislation to argue for a National Anti-Corruption Commission. And she, in the end, got the support of Labor, and they brought that in as a piece of legislation in this Parliament. So I think the crossbench work very hard to actually bring evidence-based policies which can actually create change. And I don't think it matters, in a sense, which major party forms government. If the crossbench is there in numbers, and at the moment there are 18 on the crossbench, which is the biggest number of crossbenches in the history of the Australian Parliament, I think they will argue very forcibly and will negotiate for better policy, which can improve climate action amongst many other topics across the country. So I think they're a force for good and bringing about change, which is based on scientific evidence, not based upon political opportunism. They're trying to support big corporates or the big miners in particular.
Yeah.
Well, sorry,
was just-
will they have enough power to actually switch us away from fossil fuels and, you know, kind of against all the lobbyists?
I think there's more chance if they're not there. There's little chance that's going to happen. I think what they can do is put more pressure on the government, be they Labor, be they Liberal Party, to actually bring forward legislation and amend legislation, which can actually have a much bigger impact on climate. It's the crossbench doing most of that work. And I think if you ask people what they think about the current government and the Prime Minister, many people would think he's been a bit disappointing. And I think if he listens more to the crossbench, and if there is a hung parliament, which is minority government, there'll be a lot more power which will come to the crossbench to actually create better policy for the country.
I might just jump in. There's lots of great comments in the chat you might want to take a look at. And over the coming or early in the new year, we'll be having a few further community independents coming to join us. So
Right.
if you're interested in the theme, look out for those sessions. We've got about 10-15 more minutes, and I do want to share some survey results with everyone. 60 members took part in a survey recently, and I wanted to share them. But before we, or just a very top line findings, but I just wanted to go back to some of the questions in the chat. Michelle, there's a number of people who have raised questions about insurance, and particularly from an equity point of view, and whether people will be self-insured or underinsured. And I think that ties in a little bit, or perhaps we'll cover that first and then cover some of Sue's question as well.
Thank you. So I was just looking for the questions. I think, yeah, Dr. Leheng mentioned this, that the insurance industry, as some of you may know, have been involved in climate modelling. I worked with them 15 years ago when I was a city leader and working with state and other governments in collaboration to actually look at some of the climate data and the risks involved. Will people be underinsured? I mean, we've already seen this in some of our major, bushfire events where people haven't had enough insurance or haven't understood, some of the impacts that are coming. I think there needs to be certainly governance around what can be insured and what can be excluded, because, I guess that early data and insight work that the insurance companies undertook was, could also then lead to inequities. Will people be underinsured? Yes, I think they already are. Will there need to be other potentially interventions around what can be insured and what's considered risk? I think we need to have those discussions. It's not an area that I have a lot of expertise in, but having now health insurers come into our membership, it's an active discussion that we've started. In fact, we're having a roundtable on this in the new year to really understand climate risk, inequity, and the like. So there may be other expertise, around this table, but it's something we need to understand more.
Thanks, Michelle. And I also just want to cover, Sue said she's interested in the links between mental and physical health and nature and national parks, and that climate change impacts more vulnerable people who already have less access to nature. So have you got anything that you'd like to comment in terms of just the health benefits, I suppose, of nature and the accessibility and inequities there?
Yeah, absolutely. There's some really interesting mapping. I can put a link to this story in the US, where there were lines drawn around certain areas, and you see over time, the urban heat islands where there are concrete places of, concrete and lack of trees, and where there are wealthier. And it was, in this American example, which I'll again share the story, where there are examples of greenery and greater wealth and better health, and we see that play out in Australian cities, where there are less trees, transport corridors. So, and I know that there are people on this call that could also comment on that from a frontline perspective as well. So absolutely, I've done lots of things in my career, but at City of Melbourne, when I was the sustainability leader there, we led a strategy around urban forest, and we did, the urban heat mapping, and we did studies to show and understand where people would travel and some of the vulnerabilities in the communities. We looked at air pollution. When I had a baby, and an air monitor attached to my pram level, because we weren't monitoring air pollution as it would impact children most, and we used some of that crowdsourced data to look at where we need to create more green space. And by the way, we also looked at violence and unrest in the city, and we saw there were patterns around concrete areas and heat. They're exacerbated, so we cooled those spaces where there was more tension. So that was just one example from a city approach, and I think city governments have been really, again, ahead of the game in joining all of those dots, at looking at human health and safety and using some of those levers and measures to cool spaces. Yeah, certainly Sweltering Cities is a great group that we collaborate with, that is really looking at that inequity in urban environments in particular, with a lack of greening. And there's lots of great evidence around the well-being and mental health impacts of being in nature and being surrounded by oxygen, frankly.
Makes so much sense. Thank you very much. Just before we wind up, I just wanted to tell you, as I said before, a couple of highlights from the survey. So many thanks to the over 60 people who participated and completed the survey, which Steve Lewis kindly led for us. I was just going to let you know that overall feedback was very positive, which was nice. People liked the quality and the variety of speakers. There were some great suggestions of what we could do to take the group to the next level. Some people are interested in face-to-face sessions, and other people are suggesting events at different times of the day. So we might, we have had quite a few people come to the NCC breakfast, which is usually in May or June, but we might try and do another daytime or morning event once in the year, so that we can spread the times of the day. Another idea was to have more time for Q&As and draw on the group's wisdom. So we'll also try to do that, give that a try a couple of times next year, and more focus on what people can actually do to take action and to help. So we had some great suggestions from people, and there was actually heaps more in terms of topics: mitigation, both sides of the debate, particularly for nuclear, and just a whole range of topics suggested. So if you took part and contributed, thank you so much. Rest assured that we've read all the comments, and we'll definitely be using them in formulating the plans for next year. We're also updating the website at the moment, and we're looking at how we can make more of the videos, content that we've got from all the speakers going back 5 years, and also some of the information that's on the Trello boards. We'll probably want to shift that over to the website and make that accessible for all the members as well. And if anyone wants to take part and take more of a role in the group next year, you're very, very welcome to let us know. You don't have to. You can just turn up when it's convenient and come and learn and listen. But if you do feel that you're interested in doing more, there's lots of opportunity to get more involved, and just, I suppose, let us know.
Great. And we'll send around the results for those that are interested. And we haven't forgotten, I don't know if you remember a few months ago, we had a good chat about a group of us going down to Canberra. So we're just finalising that at the moment, and that'll happen in the new year. So I think we had a list of people that were keen to go down for that, didn't we? Yeah.
Mm.
So we're probably going to do that in 2 groups, because I think we had quite a lot of our group that were keen on doing that. So we're going to try and do that before the next federal election. So we'll go and meet a bunch of MPs down there. So just bringing it all to a conclusion for today and for the year. That's a wrap. So we hope you've really enjoyed tonight's session. It's been fabulous. So thank you so much to Michelle. Keep up the great work. It's fantastic. And thank you so much, Phil and Helen. And good luck. And again, keep up the great work. I suppose just more broadly, I hope you've enjoyed the year as much as Carolyn and I have in terms of all the different sessions. We've tried to provide a good range of speakers through the year, and our aim as always is to develop our knowledge individually so that we can all take the practical steps to do our bit for the environment and biodiversity. But also, importantly, very importantly actually, is with this knowledge that we develop through these sessions, our goal is that we're all able to positively influence people in our networks to take positive action on climate and the environment. So these might be people in our work networks. I mean, all of us have very strong and broad work networks, also within our social and family networks, and using that knowledge to influence for positive outcomes there. Interestingly, if I look at our group, we look at our group this year, we started, I think, with around 400 members. We're now at over 550 members in our group. So it's really grown a lot this year. We've been going for 5 years. It all started following the bushfires in late 2019, early 20. Here we are 5 years later. And I think, over the last 5 years, Australia has come a long way in regards to the environment. If you think back to what it was like then, it was difficult. But having said that, there's so much further to go. So I think, it's also good to pat ourselves on the back every so often. And I think, all of us should be very proud of the impact that we're having. And we're a grassroots organisation that can affect positive change. So thank you to all of you for being part of this collective effort. It's fun doing it with all of you and realising that we're not alone and that change can happen. So on behalf of Carolyn and I, wishing you all a very festive Christmas and a relaxing break, and we'll start the monthly sessions back in February, and off we go again.
And I just want to say thank you to everyone too. So many people come on every month. We welcome new people, and it's great to have people who are first timers, but and thank you for joining us, but thank you also to people who come month after month. It really does make it all worthwhile. We really appreciate it.
Yeah. Thanks, everyone.
Thanks, everybody.